and this will get posted onto our website within the next day or so. At this point, I'd like to turn it over to Dr. James Karinji. Jim, the floor is yours.
Thank you, Patrick, as usual, for all you do to make these seminars happen. It's good to see everyone online today. It was really awesome to see so many people at Confluence actually mention to me how much they really appreciate these seminars. So that was great to hear. It was an awesome conference if you couldn't get there. Hope to see you next year in Helena. So today we have another excellent seminar. I want to remind everyone that the format that we're trying to adhere to here is that we realize that on Zoom you can't always leave your cameras on, but we're hoping that when we get to the portion of the program where there's question and answer, if you are able and willing to turn on your cameras, we can get a little bit more personal here on Zoom, and we appreciate that. And as is usual, we appreciate you if you keep your questions to the end. I will help our presenter look in the chat too if you'd like to present there, or raise your hand, or however that would be. But we should have some time for question at the end. So today we're very, very lucky to have Brian Norderud to present to us from Helena, the Department of Health and Human Services, and he's going to be presenting on modern geographic information systems and public health, something that we are very interested in here at the school, both as researchers and our students as well. So Brian, we really appreciate you taking time to do this today out of your busy schedules. Thank you, and take it away.
Thank you, Jim. Yeah, just to reiterate, very excited to chat with you today about this topic. I've been involved in mapping with the state for about 10 years now. And so I've had a wide variety of projects and things. Before I get into kind of my talk, I'll highlight that a little bit more. For the first kind of 5 years, I worked with the Department of Administration as a data analyst within their Facilities Condition Assessment Program. And so we created a lot of GIS maps to support those assessment walkthroughs of state buildings and recording facility building system conditions. And so that was pretty neat, but I wanted to change to something that I felt like I was helping more people. And so public health seemed like a natural place to kind of pivot towards. I got my Bachelor's of Science from Montana State University in Geographic Information Systems and Planning. And so just had a wide variety of kind of geography courses and kind of, science-based kind of classes. So, but yeah, today we're going to cover modern geographic information systems and public health. All right. For an outline today, I want to talk about a couple different things throughout this presentation. First, what determines health? We'll touch on geomedicine. Then we'll look at place and health and the importance of place. Then we'll kind of define modern geographic information systems. I've got a really great video from Esri that really summarizes the current state of geographic information systems and how it applies to all of us in our work, especially public health, environmental health, and many other disciplines. Then I just want to give some example projects so that we can put into context some of the cool work that we are doing here at the department. And then also I want to do kind of a demo for you there's a calculate composite index tool, and then look at some spatial statistics to help understand what the tool did and how we might refine our results. So in the section for what determines health, I think it's pretty important to reiterate the importance of geography, the spatial location-based information, being able to bring that data into systems where we can then do things with is really helpful. But one thing we're looking at in public health is we're looking at, what goes into health, what are the determinants of health that are operating at different in communities. And so, there's some personal things that impact health. So in this graphic, you can see it shows the Kaiser Family Foundation, and they have like a little donut chart basically in there. And you can see for personal factors that contribute to health and well-being, you've got genetics at 30%, healthcare estimated at 10%, social and environmental factors at 20%, and individual behaviors at 40%. So definitely these individual behaviors are important, but there's a lot more to consider in terms of other factors. And some of those other factors are shown in the slide here, also called social determinants of health. And the SDOH concept basically states that, the environments where people are born, live, work, and play have an impact on your health. So, if you've got an environment where you've got economic stability, you may have, good access to parks, transportation, good walkability, access to educational opportunities to advance, good access to food. You may have different outcomes than someone who does not have as good of access to those kind of factors. And so you can see in the chart, there's all these domains that are included, and these kind of build on to those individual factors I showed in the previous slide, and they contribute to health outcomes. So, as spatial scientists, epidemiologists, GIS analysts, we look at some of this health outcomes data, especially in the Chronic Disease Bureau where I work. I work in the diabetes and cardiovascular health sections. And so we're looking at a lot of these different health outcome measures, from mortality or death rates from disease. We look at morbidity or, burden of disease in communities. And then we look at things like access to care, health care expenditures, and just different demographic and social data. And so it's really a cool job. But another part of what determines health too is kind of this graphic from the University of Wisconsin Population Health Institute. I think they worked with County Health Rankings to put together this really neat graphic. So it shows kind of a pyramid format, where on the bottom, the bottom factors have the most impact. So they really stress that the socioeconomic factors that people have in terms of the, poverty status, education, housing inequality, those kinds of factors really have a large impact on, health outcomes. And you can see going up the pyramid, you have, changing context to make individuals' default decision healthy. So and then the next one is like long-lasting protective interventions and clinical interventions, and then counseling, education at the top. All those things are kind of what healthcare folks are trying to do to impact people's health. And where we spend a lot of our time is in that counseling and education portion of that. We'll provide or try to drive interventions in communities to help people find healthier food or get more exercise, or improve the access to healthcare services. And so, there's a complex kind of interplay of systems and individual factors. But you can see in here on the left-hand side, there's the kind of graphic where it shows the kind of some of the social determinants of health in themes. So, physical environment is estimated to be kind of 10% of some contributing factors for health, and then social economic factors listed at 40%, clinical care listed at 20%, and then health behaviors at 30%. And it really, I like this graphic because it also talks about the importance of health policy and how policies drive health factors that are occurring, how they impact people from place to place. and then the overall health outcomes that happen. And, the more that you can focus on kind of prevention activities across the lifespan, the more you can help in some of these other areas as you go up on some of those pyramids. So the next slide just kind of talks about place and health. One of the things that there's been some study done, I think it was Kaiser Family Foundation had an article a few years ago, but their article basically said that your zip code has more of a contribution to your health than your genetics do. So where you live and the environment where you live in really impacts your overall health across your lifespan. And, there's different level of disadvantage by place. And, a lot of the geography and GIS analysis looks at things like social vulnerability in communities or, disadvantage or neighborhood deprivation as measures to kind of figure out what's going on and differently share some of the socioeconomic and other factors occurring in communities. The graphic that you're seeing up right now, it shows the life expectancy at birth. So this was a Robert Wood Johnson Foundation Where You Live Affects How Long You Live tool. But you can see I've got Bozeman up plotted on there, and then Wolf Point. So Bozeman is Gallatin County, and then Wolf Point is Roosevelt County. And so Gallatin County, the life expectancy there's 82 years versus Wolf Point and Roosevelt County is, let me see, I think is 64 years. So, there's definitely a lot of reasons for this disparity in health. Definitely one thing to note about this information, the Roosevelt County and Wolf Point is on the Fort Peck reservation. And we know from our studies that the impacts of European colonization and the violent kind of policies of the US government over time against tribes in our state and the region have had really devastating impacts on the people. And so those kinds of traumas and violence definitely has been carried down generations and still impacts people today. And so that is one set of reasons that contributes, but you also got to think about like some of the SDOH factors like structural racism built into, kind of systems that are operating. And so, while this data does show a disparity, I do want to mention that our tribal populations are very resilient. And, this information doesn't tell the whole story. But related to at least this variable, there is a huge disparity. So when we think about geographic information systems, it's important to kind of jump back into the geographic approach. And, geography lets us look at location-based data, and it lets us analyze the kind of 5 W's. So, who, what, where, when, and why. Geography can also help us with analyzing like time data, time series data. But it's geography kind of helps us understand the complexity of our world. And, through having a lot of data in multiple different systems, we can analyze different domains like the social systems, economic systems, environmental systems, and geography integrates all of these things. And GIS is a really complex system. It's a computer-based tool used to store, visualize, analyze, and interpret geographic data. So essentially, it's the science of using geography to perform analyses and answer questions. As you can see in that graphic, it's part of a large system of software, hardware, data, GIS professionals, and then specific organizational need to drive certain analysis or create outputs. So, from using geographic information system software, We can do spatial analysis to find trends, patterns. We can find statistically significant patterns in data by using it. We can predict things. It's just a really a powerhouse of a tool to, make use of modern computing, to do things like AI and machine learning. And, there's remote sensing applications that can be used to look at imagery. And I mean, it's just a very cool technology. And so both of these kinds of things that are shown here on this slide just go together so well. And to give you kind of more of a look into modern GIS, I want to play this video for you. And it should
GIS,
start.
right? The map thing. It's got points, lines, polygons, maybe some rasters, and it represents our world. Like features in your community. But how does that data get from out there into your GIS? Spreadsheets? Paper forms? Shapefiles? Desktop-only software? Hand-drawn maps? Napkins? Text messages? There's got to be an easier way. Well, there is, and it's not as complex as you might think. We call it modern GIS. With modern GIS, the gravity of work shifts from the desktop to the cloud. So a modern GIS is a web GIS, and this makes creating, visualizing, and sharing data easier than ever. Here's how it works. The web becomes the central data repository, and desktop, mobile, and web apps access and contribute data, where these apps serve different purposes for different users. Let's say you're a Power GIS user on a desktop with ArcGIS Pro. Modern GIS lets you publish your data and analytical results to the web. Once on the web, that data can be shared with users in the field. They can quickly see your data, and they can even edit it on a mobile device with an app like Field Maps. And since that dataset being accessed in the field is now the same dataset being used by ArcGIS Pro, you'll see those edits from the field on your desktop. But the modern GIS keeps growing from here. That same data in the cloud can also be shared with configurable and no-code apps like dashboards and instant apps that can be assembled in minutes and shared with broad audiences. We even have avenues to collect data from the community with an app like Survey123. This replaces clunky paper forms with digital GIS data that you can immediately use for analysis. And data is a two-way street, right? So you can share any findings back to the community through engaging websites made with ArcGIS Hub. That's modern GIS. Maybe you tried WebGIS years ago and weren't impressed, but so much has changed in recent years. Let's explore some of what's new and easier. Imagery's come a long way. It can be stored and analyzed in the web, whether it's from drones, aircraft, or satellites. The cloud is able to perform traditional analyses like raster calculations, or advanced analytics like deep learning for object detection or pixel classification. Or maybe you're the cartography type. New styles and effects take your web maps to a whole new level for engaging your audience. Is coding more your style? Analytics, automation, and scripting of web-based data with Python and GIS libraries is now commonplace with notebooks on the web. All of this and so much more isn't just GIS. It's modern GIS. It's a system that includes everyone in your organization. The traditional geographer, data scientists, field workers, and the community. Everyone. So what are you waiting for? Jump in and learn how a modern GIS can transform your work today.
So that video just is a great example of the interconnectedness of these tools, and it really highlights how much the industry has grown over time. And, I do think it's important to kind of discuss where we came from. And there's some early epidemiological examples that I think are important to highlight. And some of these you may have heard before. So I'll just mention them briefly. So in the mid 1800s, there was a cholera epidemic in London, and John Snow was one of the folks that analyzed what was going on in that situation, and they made a really descriptive map to show it had like a neighborhood location, and there's kind of the broad street that's labeled in the middle of that map, and they looked at where pump locations were in relation to cholera deaths, and then using the kind of map, they were able to see where there was a higher density of deaths and where that was in relation to the pump. And so they were able to understand that the pump, they were able to see where there was a contaminated pump. And so they could tell people not to drink from their water there. And so that's one example. The other example is you can see on the right, this is a hotspot analysis and a geographic information systems tool that just shows the density of the deaths around the pump there. So just a cool way to see where the technology and where the thought processes has advanced, and some of the power of it. And then this example is kind of a cool one. I found an article about the Explorer doctors, but it was about basically in the early 1900s, the Montana Board of Health hired doctors Lewis Wilson and William Chowning to come investigate a illness that was occurring and causing a lot of deaths in the Bitterroot Valley here in western Montana, kind of Missoula area, and then kind of further just kind of that area shown in the map there on the kind of western Montana map there. But they did some basic descriptive epidemiology, and they looked at when cases occurred, and they kind of tracked this information and were able to plot kind of what was going on a map. And it really helped them understand more about the Rocky Mountain spotted fever. And that's a tick-borne kind of illness. And so, they're just able to do some cool stuff. And it's just an early example of, something more closer to home of like how maps were used. So I thought that was a neat example. And they kind of did some cool stuff. They distributed maps to local physicians in the areas with, fever victims, and they investigated the cases, and Chowning and Wilson went to some remote areas to talk to people, and just kind of a neat research study, but just shows the power of maps and what you can do. So some example projects I wanted to highlight for you. I mentioned earlier that I work in the diabetes and cardiovascular health program, and one of the things I did when I first started about, 6 months into my position is I wanted to do a report that looked at diabetes mortality in Montana. And I wanted to find a cool way to map this data at a census tract level so that I could show where there were some of the highest rates, and then have that be able to show where we could provide additional interventions with prevention activities and management, so that we can bring the kind of death rates down in these communities where there are high values or high rates. And so the rate stabilizing tool that you see on the left-hand image, this tool was created by the Children's Environmental Health Institute out of Notre Dame. And we work pretty closely with Joshua Toto, who's the CHI kind of geospatial director. And so they provided this RST rate stabilizing tool to the CDC for their page on their heart disease and stroke prevention page. And it's a really cool analysis. This tool generates robust local level measures of population health. And according to the description there, it's an ArcGIS based tool, and it allows users to input their own record level data to generate reliable local level age standardized measures of chronic disease. And then examples given: prevalence, incidence, and mortality, or other population health outcomes. And so what we did in our state, or at least for Montana data, is I worked with one of our epidemiologists, Carrie Oser, and she was able to do a data pull for me of death records for Montana from 2015 to 2019. And we looked at the ICD-10 code, which is like the cause of death for, listed on the, death certificate. And we were able to take and export all the ones that had a diabetes related cause. And then we're able to get a data set that we could run through this tool. And the cool thing about this tool is that one of the things that it does is it generates reliable census tract estimates of age adjusted rates. So the rates are basically spatially smooth, which means there's a statistical algorithm or Bayesian kind of modeling that goes with the that is applied to your data. And the algorithm basically stabilizes rates by borrowing information from neighboring geographic areas. And one thing we know about Montana is that it's very rural. And because one of the things that we realized is when we were running this data is that some of these areas don't have a lot of population. And so we needed to make sure we had enough cases so that we could generate reliable estimates. And so we did combine years of data to help make that smoothing part of it go smoothly. But when you generate these spatially smooth estimates, you get an age-adjusted mortality rate per 100,000 population. And so, from that, you can see on the map, there's like a significantly higher than the state average, map kind of color symbol on the tract areas. And then there's a lighter blue that says not significantly different from the state average. And then one that's significantly less than state average. And then we do have a symbol. I think it's a little bit hard to see on this. We do have like a line symbol in some of them where we didn't have reliable census tract estimates. But the power of this kind of tool is you have a confidence interval where you can say within 95% confidence that we know the true value is contained within this range of the estimate that we got. So, I mean, in Montana, we had some really high diabetes rates centered around some of the reservation census tracts. And kind of based on what I mentioned before, we know some of the historical reasons why we may see some disparities in health in those areas. But it's just a really good tool to highlight some places where we're seeing some extreme data, some extreme high death rates for diabetes. We also did this for the cardiovascular health program. But I just think this is a neat example because it really shows you how you can dig into the information and learn more about what's going on. And you have these statistically based tools that will provide you with information that you can then share with people to kind of justify why you might want to work in these locations and provide outreach and more care. So that was a neat example. We did like a quick stat report, and if anyone's interested in this, I can forward you the results or just more of the information about it. But another example that I looked at recently, so a lot of the public health department work is funded through grants. We get a lot of money from the Centers for Disease Control, and for both cardiovascular and diabetes. And there's a strategy 8 in our diabetes grant, which is requiring us to work on providing more family healthy weight programs in communities across Montana. And part of requirements from CDC is to show information spatially so that we can best make decisions about where family healthy weight curriculums and programs should be offered. And so we made this bivariate choropleth map that looks at a couple things. It looks at age-adjusted county diabetes and obesity prevalence percentages, and then it overlays that with school health clinics and WIC grocery stores. The school health clinics is important because we felt that that could be one place where more obesity, family obesity kind of resources could be provided, and they may administer some of the classes potentially that are in schools or other community institutions for people to attend to, build more skills in terms of prevention and, healthy eating and getting adequate exercise. And so you can see on this map, we've got some various items in the legend. We highlighted high burden counties with like a little blue section. And then we had the WIC stores and the school health clinics and just like a dot, and then the like grocery bag icon. But you can see the high areas all cluster around those same reservation communities that we saw on that last map. And then there are some other rural areas outside of reservations, Deer Lodge, Silver Bow County is interesting. It's in kind of the high for diabetes in here, but you see a lot of the rural areas in Montana have some higher values than do like southwestern Montana, Gallatin, Livingston, Lewis and Clark County. Missoula County is a little bit lower than others. So, we found some pretty high impact. We include some impact statements in the map. So we found that only 15% of WIC accepting grocery stores are in high burden areas. So that was only 30 locations out of 195. Only 22% of school health clinics are in high burden areas. That was 16 out of 72. And on here, we list 3 out of 11 counties. I would actually say this is probably more than that, but they're 3 out of 11 we have listed are USDA low income, low access food deserts. And then I looked at the average age adjusted physical inactivity rate for those high burden counties, and that was at ranged all the way as high as 30.8% of the population, is considered physically inactive, and that was at Glacier County. So it's just kind of some information. You can see how these chronic disease comorbidities kind of overlap, but then you can also see that there's not as much services in these rural areas, and it just really highlights the need of why resources are needed in the high burden areas, and highlights what the situation is. So that's kind of a cool example. Other things we have a Join Healthy Living story map. This has been a great collaborative project across DPHHS. It started out of the State Health Improvement Plan, and kind of we wanted to have a one-stop shop where people could come to find resources about healthy eating, getting adequate physical activity, and then just other resources about community programs for maintaining health. And let me just share this real quick with you. I'm going to stop share, and then I'm going to go over to the screen. And then I got to share screen. All right. Hopefully that came up for you. So here's the Join Healthy Living story map. In here, you can see it's kind of a nice, clean layout, modern kind of looking layout. that provides information to kind of a general public audience. We have kind of unique or cool photos in here and have set it up with like kind of our branding and stuff, but you can go through here and just see a lot of cool information displayed in a very appealing way. And I've been working on this project with grad student Nicole Boyson. So shout out to her. She's made a ton of really cool edits to this story map and helped us kind of refine our presentation of the content. And so I'm really excited about this project because we've really reduced the amount of scroll in here, but we provide a ton of data and links and resources for people out there in the public that may need some assistance. And this can be shared by a lot of other healthcare professionals across different settings, and we just have made it really a cool resource. So yeah, I wanted to highlight that there. And then I'm going to go back to the story map. Hopefully that switched over. So the next example, next example is in our cardiovascular health grants. We have a couple grants right now. We've got the Wise Woman grant, which is a new one for the CVH program this year. And then we've got the 2304 grant, which one of the parts of it is a cardiovascular health learning collaborative. And in that particular grant, the Centers for Disease Control had asked us to find priority census tracts where there were populations of high need within those tracts that are at high risk for cardiovascular conditions like stroke, heart disease, hypertension, high cholesterol, focusing on kind of risk factors that contribute to those conditions. And so I worked with Carrie Oser to develop this map called Composite Score to identify high priority populations at risk for cardiovascular health conditions. And this map was really a neat kind of collaboration. Carrie and I worked on this map for quite a while. But what you're seeing on that map, you can see that there's a lot listed in that legend, but I'll point out so that the composite score is one of the main elements, and how that was calculated is Carrie worked with the Children's Environmental Health Institute out of Notre Dame to pull the most recent version of their neighborhood deprivation index. And, a neighborhood deprivation index is basically an index that looks at multiple socioeconomic factors, and it basically takes those factors and values by each location and it combines them together to give an overall score. So a higher score would mean that there's a higher level of need, or I guess in the higher neighborhood deprivation score. But she then, using that neighborhood deprivation index, she also added in values. So on the composite score, she looked at and added in hypertension value at the top 20th percentile for each of the areas. And then she looked at 5 or 6 of each of these comorbidities. So high cholesterol, diabetes, obesity, current smoking, coronary heart disease, and stroke. And basically what she did is she added the neighborhood deprivation index and then added the all the values where they had over these percentiles together. And so and then just for simplicity of sharing this on a map, the ones that had the highest overall values were labeled as a 1, and then the ones that were lower in the value class were labeled as 0. So you can see some of the areas where the values showed up. I do remember Carrie mentioned that Glacier County was added on here. I don't remember why Glacier County didn't show up in this version of the map, but I do think that was added in a previous version. But anyhow, you can see how these kind of high risk areas also line up with some of the tribal communities and other rural parts in Montana. And you can see in here, we've got our year 1 cardiovascular health projects. So you can see where projects are at. And one of the things I should probably mention is the Learning Collaborative is a group of healthcare professionals across the state who are advising kind of the cardiovascular health program of how we should work within communities to address cardiovascular health risk. And so, you know, we're using the community's direct input to make sure that we're working in effective ways, in ways that are appropriate, you know, culturally appropriate and sensitive to community members' needs. But you can see there's projects in here like community health workers, grants or activities. There's food pharmacy, HCHC, which is health care, coaches for hypertension control. We've got some health equity grant stuff that is funded, hands-free CPR program, loaner program. And then the Wise Woman program is a specific program that is focused on the population of women, I think 40 to 64 years of age, who are underinsured or who have a very tough socioeconomic situation. And that program, there's various clinics that are operating in Flathead County where they are doing increased like screenings for different conditions. And so it's kind of focusing on a specific population. But I think this map just is a good example of showing how much is going on. And, you know, we also show it with the stroke recognized critical access hospitals and then telestroke locations. So you can just kind of get a sense spatially where all this stuff is next to each other. And it helped us determine where we were going to work. And so I think just a neat example. So the next example, I've got this map. I'm going to try to do a little bit of a demo for you. Hopefully everything works. I'm a little nervous that hopefully we don't have some issue come up where I can't show something for some reason. But I will close out of this really quick, and then I'm going to go over to a window that I have open. I think it's this one. It says I'm still screen sharing. So what I wanted to kind of demo for you is this Calculate Composite Index tool. This is a neat item just because it's, you know, before we had this tool, it would have been very hard to do all the steps that are involved in this. Let me go. I just want to show this graph here, this first. So this Calculate Composite Index tool is really cool. It's in ArcGIS Online, but a composite index is a pretty popular GIS analysis method right now, and they're used across social and environmental domains to represent complex information from multiple indicators as a single metric that can measure progress towards and facilitate decisions. And so you can see in that illustration kind of what goes into it. You have various variables. Those are combined in a way that's standardized. And then you can output like an index score that will give you a rank number to tell you which areas are kind of high and low in terms of need. And so you can see that kind of 1 through 10 graphic that gives you more information about the steps. I won't go through all those, but there's kind of a lot involved, and that ArcGIS Online tool makes it easier to actually view that. So if you're in ArcGIS Online and you're in the new map viewer, there's a section where you can select this analysis tool, and then you can do Calculate Composite Index. And if I click on that, it will you know, open up this tool, and you can start looking at things. I think I have it located in the bottom here, but I just want to show you that I've got a hosted feature layer with various variables. And the question I wanted to look at is looking at obesity risk for, I guess I have county level data. And so I want to see if I can create an index that starts to look at that. So you can see you've got some inputs in here. you can go in here and you can select fields, you know, and it will, based on the layer you choose, it will find your data, and then you can then view the data or the fields in here and select each of these fields. And I had kind of already done this just for the sake of time to make sure I could get through everything. But I did select probably 10 different variables that I thought would represent, you know, obesity risk. And from that, I could get some results in here. The tool would generate some outputs for me, and you could select some different ways to run the analysis. And so the one I selected for this time was highlighting extreme values. So I could tell the software, the tool, to give us a rank index that looks at places with values over the 90th percentile for across these different variables. And you see it's kind of the same reservation areas are kind of coming up again in the results that we got. But I think an important thing about this information is to further analyze the result we got. So one of the things you can do in ArcGIS Online is bring your hosted feature layer results into ArcGIS Pro, and you can actually do more within Pro to evaluate the result you got. So I can show you that now. So here's, hopefully the screen still shows up for you. Here's kind of a ArcGIS Pro screen, and here's that same view of the data that I just had up in online. And so right now what you're seeing is I chose to symbolize this using a standard deviation measure. So it'll show the results 1 to 3 standard deviations away. And so the 3 values that you see on the map in the dark purple, these are more extreme values since they're kind of at that 3 standard deviation level. And so that's one interesting thing. But, you know, maybe I want to determine, you know, how well did the variables I pick contribute to the overall index result. And so to do that, one of the things you can look at is a statistical measure in here called Pearson's R. And if I open this, hopefully it will load okay. It is loading, okay. And then if I look at this in here, so I remember all the variables I showed in the entry screen on ArcGIS Online that I could select and weight. Well, this Pearson's R scatter plot matrix will take these variables and it will create a matrix dot chart, you know, and it will, for each one of these variables, it will give me a graph for each of them that I can see, and it will color code these with a green color, and it will color code them with a pink color. And so the pink colors are ones that are don't contribute as much to the overall result. These green colors that are closer to 1 contribute more to the result. And so here we're kind of looking at the correlation of variables, and we're seeing, you know, which relationships were kind of prioritized in the index result that we got. So this is just a really powerful tool because, you know, without looking at some of these graphs, you wouldn't know as well how to interpret what results you got. And so you might be able to use this Pearson's R to then refine which variables you include by removing some of these ones that don't really contribute in a meaningful way. And it will also probably help you not get into a situation where you're intentionally weighting a variable too much. So just really useful information. And then I just want to mention this because I think this is really important in our work. And so one of the items that's really important when we think about spatial statistics and finding patterns in GIS workflows is using some of the tools like Local Moran's Eye, which is a kind of algorithmic method to, it applies, it looks at a measure called spatial autocorrelation, which is looks at within your map in like a local sense or like a region, how spatial or how values cluster together, either high or low spatially. And this spatial autocorrelation measures are really interesting because you can find ways in your data, like you can find patterns, statistically significant patterns, that aren't the result of just a random situation. And so let me just show you this really quick in ArcGIS Pro. So if I turn on this one, it might be taking a little bit to load. Let me turn this other one off. It's having trouble loading. Let me see. For some reason, it does not want to load. But anyhow, I'll just go back to the graphic here. You can see right in this map, if I zoom over, you can see that there's Valley County and Daniels, and then Toole, Liberty County. There's two high clusters in both Valley and Liberty. And then in Daniels and Toole, there's low-high outlier. And what we can tell from there is that there's some interesting spatial pattern going on that we need to investigate further. And, being that there's some low values out here that are very different from Valley's high county values, means there's something kind of interesting going on. And so without running these tools, sometimes you wouldn't be able to see these relationships. And that's kind of the power of modern GIS, is that you're seeing things that other people can't see through these tools. And you have statistical justification for saying like, hey, this area of the state needs more attention, and for these reasons, and we know within this amount of confidence. And I guess within these kinds of analysis where you're looking at clustering of data, you have to analyze that within relation to like a null hypothesis, and look at the p-values and the local Moran's I value. And you have to say, if the value's low enough, it'll have some statistically significant pattern. But anyhow, I just think that's a good way to wrap up the kind of power of GIS analysis for public health. I mean, it's so helpful for where to allocate resources, but also for determining how social determinants of health impact people, but then also just like what's going on with my data. And then I can have statistical tools to better evaluate that and then make better decisions. So yeah, I guess with that, let me know if you've got any questions, and that's all I've got for right now.
Thank you so much, Brian. There's a wealth of information there, and I can see so many ways that this will enhance the research that we're doing here in the state, the academic health department, and otherwise here at the school. So any questions that folks have? We've got probably about 5 minutes left, probably time for a couple of questions. If you want to pop that in the chat or unmute, I'm sure Brian will try to answer your question.
Yeah, hey, Patrick Boyce here. Brian, I met you at one point back in Helena, and I haven't followed up, but it brings up a few different things, and especially with ArcGIS, as you're thinking about, or as I'm thinking about things like dashboards or like public-facing information. The two questions that came up for me were, one, data security. So like, can we have it automatically hide or suppress, when we have cell values that are particularly small? And how does that work when we think of other, like data use agreements, where ArcGIS is sort of having access to this data that's sensitive? So how do you go about making sure that it's clean enough for that? And the second one is accessibility. the ArcGIS dashboards, what are the accessibility, evaluations that we've done on those?
Yeah, thanks, Patrick, and good to see you again. It was always good chatting with you, and thanks for your questions there. So the first one, you mentioned the like data release kind of situations or security around using data within like the ArcGIS Pro or other tools. And this one's a really interesting thing. I'm trying to think of the best way to kind of cover a comprehensive answer on this. So I would say for like, a lot of the work that we're doing, we have recently created a HIPAA compliant geocoder so that if we're creating or if we have to like locate a bunch of points on a map, we're not accidentally releasing information or putting information out where it could be somehow seen by another party. So we did do some work to create that HIPAA compliant geocoder that's behind kind of the DPHHS firewall. And before we had that geocoder in place too, we did recommend that people like strip out any data that was confidential and just use like an ID number for a record so that they could put the geocoded information through the locator service, get the points located, and then they could join that information in that table back using that ID number. But this new HIPAA compliant geocoder that we have, that's going to really help us prevent a situation where maybe somebody forgets and accidentally run something through. And I don't think we ever really had any like data breaches necessarily with our geocoding. But it is also important to mention, so for like data release and like showing maps or like, so one example I have is like we made some like syphilis case count maps by county, and some of the counties had lower than 5 cases. And so in those cases, we'd have to go in and do a specific filter on the data to not display counts that are over or that are under that number for that county. And so there are definitely some spatial methods you can apply to data to I don't know if it's called, I think it's maybe called jittering, or you can also like move points a little bit off their locations to like conceal privacy if you need to show a spatial pattern, but you don't want, a point to be identified to some location. So there are some statistical methods that allow you to present data in your maps if you've got like case count data or other data that you need to kind of move it. You can also aggregate data to like a chronic disease region or some other geography that helps protect privacy. But the privacy issue is a huge thing that is really hard for us in the kind of public health department. I mean, the protections around data, like we want to be sure that data is protected, and so like we run into a lot of the like HIPAA rules and other data protection rules, and it makes it hard sometimes to use data and access it. And so I think I think we have more of a challenge than some of the other state agencies, because we are working with data, dealing directly with patients and people. And so for the accessibility part of the question, that particular item, one thing that's nice for like apps that are on ArcGIS Online, like there's like the Experience Builder app or Web App Builder or Story Maps or dashboards. A lot of those resources have like an accessibility team behind them that works on providing adequate measures to like add alt text to maps and alt text to images, and then other accessibility features within those particular apps. And one thing we've done for accessing our maps for accessibility is we have downloaded like a screen reader tool like NVDA. And so you can actually go through a map and you can test the functionality out with the screen reader and like make sure that the alt text works, and you can have like a good experience with it. And so I think with Esri stuff, they're always kind of trying to improve on the accessibility they give you out of the box. And I think with maps, sometimes it is hard to always make that 100% accessible. Like if it's an interactive map where you have to go click on things and then pop-ups come up. And sometimes what we've done is we've put like a disclaimer notice in our products that you know, basically along the lines of, you know, we've made efforts to make this map accessible. If you would prefer this in a different format, you know, we can provide that, and then we'll usually give like a contact. So hopefully that answers your question. I think there could be more done in terms of accessibility of these items. I think it's just a challenging area with some of the mapping tools. But yeah, good questions.
Brian, thank you so much. We're out of time. And I'm sure that folks will contact you if that's okay with further questions. Great to see the connection between you and Patrick. And yeah, thank you so much.
Thank you.
Really
Have a
appreciate
great
it.
rest of the day.
All right. Bye-bye.
Thanks.
Bye.